This one vitamin deficiency is destroying the brains of millions of seniors right now, and you literally cannot get enough of it without eating meat. As a physician who has spent over 20 years treating neurological disorders and cognitive decline in older adults, I need to warn you about the most dangerous nutritional deficiency affecting people over 60. A deficiency so devastating that it causes permanent brain damage, irreversible nerve destruction, and cognitive decline that is clinically indistinguishable from Alzheimer's disease, yet it is completely preventable if you know what to look for and how to fix it. Millions of people over 60 are walking around right now with critically low levels of this vitamin, experiencing symptoms they believe are normal aging, symptoms their doctors dismiss or misdiagnose, while their brain tissue is being systematically destroyed from the inside out. What almost no healthcare provider will tell you, what the plant-based movement absolutely does not want you to know, is that this vitamin exists in adequate amounts only in meat, that plant sources and supplements are largely ineffective for most people, and that after 60 your ability to absorb this vitamin declines dramatically, creating a perfect storm where deficiency becomes almost inevitable unless you take specific action. And today, I am going to reveal exactly which vitamin this is, why it is so critical for brain health, how to know if you are deficient, and most importantly, which specific types of meat provide the highest concentrations in the most absorbable forms to prevent and reverse the devastating neurological damage this deficiency causes. Stay with me until the very end because I have something critical to share that will completely change how you understand this vitamin and could literally save your cognitive function and your life. I am Dr. Marcus Richardson, a board-certified physician specializing in geriatric neurology and nutritional medicine, with over 2 decades of clinical experience diagnosing and treating vitamin deficiencies that destroy brain function in older adults. And today, I want to expose a medical crisis that is hiding in plain sight, that is causing massive suffering, that is being systematically missed by conventional healthcare, and that is entirely preventable with proper nutritional knowledge. Let me tell you something that will shock you and probably make you furious when you realize how many people are suffering unnecessarily. I have patients who are 65, 70, 75, 80 years old who come into my office with devastating symptoms. They tell me they cannot remember conversations from an hour ago. They tell me they are experiencing numbness and tingling in their hands and feet that is progressively getting worse. They tell me they have crushing fatigue that makes getting out of bed feel impossible. They tell me they are depressed and anxious for the first time in their lives. They tell me they feel mentally confused, like they are living in a fog. They tell me they are losing their balance and coordination. They tell me they have difficulty walking and keep falling. And when I ask about their medical history, a pattern emerges that breaks my heart every single time. Their primary care doctors ran standard blood work and told them everything was normal. Or they were told their symptoms are just normal aging and there is nothing that can be done. Or they were diagnosed with early dementia or Alzheimer's disease and told to get their affairs in order. Or they were prescribed antidepressants for the mood symptoms without anyone investigating the underlying cause. And all the while, they have been suffering from a completely treatable nutritional deficiency that is destroying their nervous system day by day, hour by hour, causing damage that becomes increasingly difficult to reverse the longer it goes untreated. The vitamin I am talking about is vitamin B12, also called cobalamin, the single most critical nutrient for nervous system function, and the one nutrient that is absolutely impossible to obtain in adequate amounts without eating meat. I need you to understand with complete clarity how serious this is. Vitamin B12 is not optional. It is not something you can be a little low in without consequences. It is an absolute non-negotiable requirement for life itself, and specifically for the survival and function of your nervous system. Every single nerve cell in your body, every neuron in your brain, every nerve fiber in your spinal cord, every nerve that controls your muscles, your sensation, your coordination, all of them require vitamin B12 to function. Without adequate B12, your nervous system begins to die. And unlike many other nutrients where you might experience symptoms but no permanent damage, B12 deficiency causes irreversible neurological destruction if it goes untreated for too long. Here is what happens when B12 is deficient. First, you cannot produce myelin, the fatty insulating sheath that wraps around nerve fibers and allows electrical signals to travel quickly and efficiently. Without myelin, nerve signals become slow and weak, like trying to send electricity through wires without insulation. This process, called demyelination, is the same mechanism that occurs in multiple sclerosis, except with B12 deficiency, it is happening throughout your entire nervous system. Second, you cannot properly maintain the nerve cells themselves. The cell bodies of neurons begin to degenerate. Axons, the long projections that carry signals, start to die back. This causes permanent loss of nerve function that cannot be fully restored even if you correct the deficiency later. Third, toxic metabolic byproducts accumulate in your blood and tissues, particularly homocysteine, which directly damages blood vessels throughout your body, including the delicate capillaries in your brain, causing vascular dementia. The tragedy that keeps me awake at night is how completely preventable this suffering is. We have known about vitamin B12 deficiency and its devastating effects for nearly 100 years. We have simple blood tests that can diagnose it. We have effective treatments. And yet, millions of seniors are deficient right now without knowing it, without being tested, without being treated, watching their nervous systems deteriorate while they are told their symptoms are normal aging. The reasons for this catastrophic failure are multiple. Doctors rarely test for B12 unless symptoms are severe and obvious. The standard blood tests miss many cases of deficiency. The symptoms are vague and easily attributed to other causes. And most dangerously, the nutritional advice people receive actively promotes diets low in the only reliable source of B12, which is meat. People are told to reduce red meat consumption for heart health without anyone warning them about the neurological consequences. People are encouraged to try plant-based diets without understanding that plants do not contain bioavailable B12. Seniors are prescribed medications that interfere with B12 absorption without anyone monitoring their levels. The result is an epidemic of preventable brain damage that is destroying lives while the medical system looks the other way. Today, right now, I am going to give you the knowledge that can save your nervous system. I am going to explain exactly what vitamin B12 does, why you absolutely need meat to obtain it, how to know if you are deficient, which meats provide the highest amounts in the most absorbable forms, and what to do immediately if you suspect deficiency. This information could prevent years of suffering and irreversible damage. This information could save your cognitive function and your independence. This information could literally save your life. When I talk to my patients about vitamin B12 deficiency, I always start by explaining why this particular deficiency is so uniquely dangerous and why people over 60 are at such extraordinarily high risk. Unlike deficiencies of other vitamins that might cause uncomfortable symptoms but no permanent damage, B12 deficiency causes irreversible destruction of nervous system tissue. Once nerve cells die, once myelin is stripped away, once axons degenerate, the damage is permanent. You can stop further destruction by correcting the deficiency, but you cannot fully restore what has been lost. This is why early detection and prevention are absolutely critical. Let me explain the specific mechanisms by which B12 deficiency destroys your nervous system. Vitamin B12 is required for two critical enzymatic reactions in your body. The first is the conversion of methylmalonyl-CoA to succinyl-CoA, a reaction necessary for proper metabolism of fatty acids and amino acids. When this reaction cannot proceed due to B12 deficiency, methylmalonic acid accumulates in your blood and tissues, reaching toxic levels. This accumulated MMA directly damages nerve cells and disrupts the formation and maintenance of myelin. The myelin sheaths around your nerves become unstable and begin to break down. This demyelination affects nerves throughout your body, but is especially devastating in the spinal cord and brain, where it causes a condition called subacute combined degeneration. This produces progressive weakness, numbness, tingling, loss of balance, difficulty walking, and eventually paralysis if untreated. The second critical reaction is the conversion of homocysteine to methionine, which requires B12 and folate working together. When B12 is deficient, this reaction slows or stops, causing homocysteine levels to rise dramatically. Elevated homocysteine is directly toxic to blood vessel walls, causing endothelial dysfunction and promoting atherosclerosis throughout your circulatory system. In the brain, this vascular damage reduces blood flow to neurons, creating chronic hypoxia where brain cells do not receive adequate oxygen. Over time, this leads to vascular dementia with progressive memory loss, confusion, and cognitive decline. Additionally, The methionine that should be produced from homocysteine is needed for methylation reactions throughout your body, including the production of neurotransmitters, the synthesis of DNA, and the maintenance of cell membranes. When methylation is impaired, numerous biological processes fail. Now let me explain why people over 60 are at such extraordinarily high risk for B12 deficiency, much higher than younger adults. The reason is that B12 absorption is a complex, multi-step process that degrades significantly with age. When you eat meat containing B12, the vitamin is bound to proteins in the muscle tissue. In your stomach, hydrochloric acid and the enzyme pepsin work together to cleave B12 from these proteins, releasing free B12. This free B12 then binds to a protein called R-binder that protects it as it moves through your stomach. In your small intestine, pancreatic enzymes break down the R-binder complex and transfer the B12 to intrinsic factor, a protein secreted by cells in your stomach lining. The B12 intrinsic factor complex then travels to the end of your small intestine, where specific receptors bind it and transport it across the intestinal wall into your bloodstream. Here is the critical point. Every single step of this process declines with age. After 60, stomach acid production drops dramatically in most people, a condition called hypochlorhydria or achlorhydria. Without adequate stomach acid, B12 cannot be cleaved from food proteins, so even if you eat meat, you cannot access the B12 it contains. Intrinsic factor production also declines with age and can be lost completely due to autoimmune conditions like pernicious anemia, which affects up to 10% of people over 60. Without intrinsic factor, B12 cannot be absorbed no matter how much you consume. Pancreatic enzyme production decreases, impairing the transfer of B12 from R-binder to intrinsic factor. The receptors in the small intestine that bind the B12 intrinsic factor complex become less efficient. Every part of the absorption process deteriorates, creating a situation where older adults need more B12 due to increased requirements for tissue maintenance, but absorb dramatically less from food. Additionally, many medications that are commonly prescribed to older adults severely interfere with B12 absorption. Proton pump inhibitors like omeprazole, which millions of seniors take for acid reflux, suppress stomach acid production, and virtually guarantee B12 deficiency if used long-term. Metformin, used by millions for diabetes, interferes with B12 absorption in the small intestine and causes deficiency in up to 30% of users. H2 receptor antagonists like ranitidine also reduce stomach acid and impair B12 absorption. Antibiotics can disrupt gut bacteria that play supporting roles in B12 metabolism. Seniors taking multiple medications, which is extremely common, face compounding effects that make deficiency almost inevitable without supplementation or very high dietary intake from the most bioavailable sources. Let me tell you about Dorothy, an 81-year-old woman who came to my office in a wheelchair, unable to walk unassisted. Over the previous 2 years, she had developed progressive weakness in her legs, numbness in her feet that crept up to her knees, severe balance problems, and cognitive confusion. Her primary care doctor diagnosed her with normal aging and probable early Alzheimer's disease. She was placed on donepezil for dementia. Her family was planning to move her to assisted living because she could no longer care for herself safely. When I examined her, I saw classic signs of B12 deficiency, including loss of vibration sensation, loss of position sense, weakness, and abnormal reflexes. Her blood work showed B12 of 140 picograms per milliliter, severely deficient. Her methylmalonic acid was extremely elevated, confirming functional deficiency at the cellular level. I immediately started her on high-dose B12 injections, 1,000 micrograms intramuscularly twice per week. Within 3 weeks, her mental clarity began to improve. Within 6 weeks, sensation was returning to her feet, and her strength was increasing. Within 3 months, she was walking independently with just a cane. Within 6 months, she was living alone again, mentally sharp, fully mobile, completely independent. She did not have Alzheimer's disease. She did not have irreversible neurological disease. She had a nutritional deficiency that destroyed her nervous system for 2 years while doctors missed it, a deficiency that was completely correctable once properly diagnosed. If I had seen her a year earlier, the recovery would have been even more complete. If the deficiency had gone untreated another year or two, much of the damage would have become permanent. Are you over 60 and experiencing any neurological symptoms like numbness, tingling, balance problems, memory loss, or unexplained fatigue? Has anyone ever tested your vitamin B12 levels? Drop a comment below and share your experience, because understanding how common these symptoms are and how rarely they are properly evaluated will help you realize you are not alone. Now let me explain exactly why meat is the only reliable source of vitamin B12, and why plant-based sources and many supplements simply do not work, especially for people over 60. This is not opinion. This is not dietary philosophy. This is fundamental biochemistry that every nutrition professional should understand, but that many either do not know or choose to ignore, because it contradicts their ideological preferences. Understanding this will help you make informed decisions about your diet and protect your nervous system from preventable damage. Vitamin B12 is synthesized exclusively by certain bacteria and archaea. It does not exist in plants. It does not exist in fungi. It does not exist in any organism that performs photosynthesis. The only way B12 enters the food chain is through bacterial production. Ruminant animals like cows, bison, sheep, and goats have bacteria in their digestive systems that synthesize B12. These animals absorb the bacterial B12 and incorporate it into their tissues, particularly muscle tissue and organs. When you eat meat from these animals, you are consuming the B12 that was synthesized by bacteria and stored in animal tissue. This B12 exists in the active coenzyme forms methylcobalamin and adenosylcobalamin, bound to proteins in a food matrix that your body is evolutionarily adapted to digest and absorb. Plants do not contain B12 despite claims you may have heard. Some plant foods are contaminated with bacteria that produce small amounts of B12, but these amounts are nutritionally insignificant and unreliable. Some fermented plant foods like tempeh or kimchi may contain tiny amounts of B12 from bacterial activity, but again, these amounts are insufficient to meet human needs, and the forms may not be bioavailable. Nutritional yeast is grown on B12-enriched media and contains added synthetic B12, but it is not a natural plant source, it is fortification. Algae and spirulina contain B12 analogs, compounds that have similar structures to B12, but that do not have biological activity in humans, and that can actually interfere with B12 absorption and metabolism, making deficiency worse. The highest concentrations of B12 are found in organ meats, especially liver, which serves as the storage site for B12 in animals, just as it does in humans. Beef liver contains approximately 70 micrograms of B12 per 3-ounce serving, which is nearly 3,000% of the minimum daily requirement. This is why liver has been used throughout history to treat pernicious anemia before the specific cause was understood. Kidney is also very high, containing about 25 micrograms per 3-ounce serving. Muscle meats contain lower but still substantial amounts. Beef, lamb, and bison contain approximately 2 to 3 micrograms per 3-ounce serving. Pork contains about 1 microgram per 3 ounces. Chicken and turkey contain about half a microgram per 3 ounces. Fish and seafood are also excellent sources, with clams and oysters being extraordinarily rich at over 80 micrograms per 3-ounce serving, salmon containing about 3 micrograms, and tuna containing about 2 micrograms. Now let me explain why the form of B12 matters enormously, and why food sources are superior to most supplements. Vitamin B12 exists in several different forms. The two active coenzyme forms used by your body are methylcobalamin, which is required for methylation reactions including neurotransmitter synthesis and homocysteine metabolism, and adenosylcobalamin, which is required for energy metabolism and the prevention of methylmalonic acid accumulation. Meat naturally contains both of these active forms. When you eat meat, you get B12 that your body can use immediately, without conversion. Most supplements, however, contain cyanocobalamin, a synthetic form that does not exist in nature. Your body must convert cyanocobalamin to the active forms through multiple enzymatic steps that require adequate levels of other nutrients, and that depend on genetic factors. Approximately 40% of people have variations in the MTHFR gene that impair their ability to methylate nutrients, including the conversion of cyanocobalamin to methylcobalamin. These people can take massive doses of cyanocobalamin supplements and still remain functionally deficient because they cannot convert it to usable forms. Additionally, cyanocobalamin contains a cyanide molecule that must be detoxified and excreted, placing an unnecessary burden on your liver. For people with MTHFR variations or compromised methylation capacity, which includes many older adults, supplementing with methylcobalamin is more effective. But even methylcobalamin supplements are absorbed less efficiently than B12 from food, because they lack the food matrix and cofactors that enhance absorption. There is also the critical issue of intrinsic factor. Most oral B12, whether from food or supplements, requires intrinsic factor for absorption. If you have pernicious anemia or age-related loss of intrinsic factor, oral intake will not work regardless of dose. This is why people with severe B12 deficiency require intramuscular injections that bypass the digestive system entirely. However, small amounts of B12 can be absorbed through passive diffusion without intrinsic factor, but this requires very high doses, typically 1,000 micrograms or more. This is why people with absorption problems often take sublingual or very high-dose oral methylcobalamin supplements. But again, food sources are superior when absorption capacity is intact because of the synergistic effects of the complete nutrient matrix. Let me tell you about Gerald, a 68-year-old man who had been following a vegetarian diet for 5 years after watching a documentary that scared him about meat. He supplemented with a standard multivitamin containing cyanocobalamin. Over those 5 years, he developed progressive memory problems, depression, fatigue, and numbness in his feet. He assumed these were normal aging. When I tested him, his serum B12 looked adequate at 400 picograms per milliliter, but his methylmalonic acid was severely elevated at 900 nanomoles per liter, indicating functional deficiency at the tissue level despite apparently adequate blood levels. This is why MMA testing is crucial. His body could not properly convert the cyanocobalamin in his multivitamin to active forms, so despite supplementing, he was deficient where it mattered, in his tissues and cells. I recommended he resume eating meat, specifically grass-fed beef and lamb, at least 4 times per week, and that he switched to methylcobalamin supplements while his levels recovered. I also started him on B12 injections initially to rapidly correct the severe deficiency. Within 2 months, his MMA normalized. His symptoms began improving and his cognitive function was noticeably better. Within 6 months, he was back to his baseline mental sharpness. His depression had completely resolved, and the numbness was gone. The vegetarian diet and inadequate supplementation had caused years of unnecessary suffering and potentially permanent damage that was only reversed because we caught it relatively early. Before we continue, I want to ask you something crucial. Are you currently avoiding or limiting meat because you believe it is unhealthy? Are you relying on supplements for B12 instead of food sources? Comment below and tell me about your dietary approach, because understanding your current strategy will help you recognize the risks you may be facing. When I explain to patients how to know if they are B12 deficient, I always emphasize that this is more complicated than most people realize, and that standard medical testing often misses deficiency. Understanding how to properly evaluate B12 status and recognizing the early warning signs of deficiency could be the difference between preventing damage and suffering irreversible neurological destruction. Let me give you the information you need to advocate for yourself and ensure you are properly evaluated. The most common test for B12 is serum B12, a simple blood test that measures the amount of B12 circulating in your bloodstream. The problem is that this test is notoriously unreliable. The reference range used by most laboratories defines deficiency as below 200 picograms per milliliter. But research shows that neurological damage can occur at levels well above this cutoff. Many experts now believe that optimal levels are above 400 or even 500 picograms per milliliter, and that levels between 200 and 400 represent subclinical deficiency that can cause symptoms and tissue damage despite being labeled as normal by conventional standards. Additionally, serum B12 measures total B12 in your blood, including both active and inactive forms. You can have normal or even high serum B12, but still be functionally deficient if the B12 is not in active forms or is not getting into your cells where it is needed. This is why additional testing is critical for accurate diagnosis. Methylmalonic acid, or MMA, is a metabolic byproduct that accumulates when B12 is deficient at the cellular level. Elevated MMA, anything above 270 nanomoles per liter, indicates functional B12 deficiency, regardless of what your serum B12 level shows. MMA testing is much more sensitive and specific than serum B12 for detecting true deficiency. Homocysteine is another marker that rises when B12 or folate is deficient. Elevated homocysteine, above 10 or 12 micromoles per liter depending on the laboratory, suggests deficiency and also indicates increased cardiovascular risk. The most comprehensive evaluation includes serum B12, MMA, homocysteine, and a complete blood count to look for macrocytic anemia, the enlarged red blood cells that occur in B12 deficiency. Now let me describe the symptoms of B12 deficiency so you can recognize them in yourself or loved ones. The challenge is that B12 deficiency causes a wide range of symptoms affecting multiple body systems, and the symptoms often develop slowly over months or years, making them easy to dismiss as normal aging or to attribute to other causes. Neurological symptoms include numbness and tingling, usually starting in the feet and hands and potentially spreading. Loss of position sense where you cannot tell where your limbs are in space without looking. Loss of vibration sense. Difficulty walking, unsteady gait, and poor balance. Muscle weakness, especially in the legs. Memory problems and difficulty concentrating. Confusion and cognitive impairment that can mimic dementia. Depression, anxiety, irritability, and mood changes. In severe cases, psychosis or hallucinations. Hematological symptoms include fatigue and weakness from anemia, pale skin, shortness of breath with exertion, rapid heart rate. Gastrointestinal symptoms include loss of appetite, weight loss, constipation or diarrhea, and a sore or inflamed tongue called glossitis. The wide variety of symptoms means that B12 deficiency is often misdiagnosed as other conditions including depression, anxiety disorders, Alzheimer's disease, Parkinson's disease, multiple sclerosis, peripheral neuropathy from diabetes, or simply normal aging. This diagnostic confusion means many cases go undetected until damage is severe. Who is at highest risk? People over 60 due to reduced stomach acid and intrinsic factor production. People taking proton pump inhibitors, metformin, or other medications that interfere with absorption. People who have had gastric surgery including gastric bypass or gastrectomy. People with autoimmune conditions including pernicious anemia, Crohn's disease, or celiac disease that damage the stomach or intestinal lining. People following vegetarian or vegan diets who do not supplement properly. People with chronic alcohol use which damages the stomach lining and impairs absorption. If you fall into any of these categories, you should have your B12 status evaluated comprehensively with serum B12, MMA, and homocysteine testing. Let me tell you about Marcus, a 73-year-old man who came to my office at the insistence of his daughter. He had been experiencing progressive cognitive decline over 3 years. His memory was poor. He was confused frequently. He had lost interest in activities he used to enjoy, and he was increasingly withdrawn and depressed. His primary care doctor diagnosed early Alzheimer's disease based on cognitive testing and prescribed a cholinesterase inhibitor. His daughter researched online and suspected B12 deficiency based on his symptoms and the fact that he had been taking omeprazole for reflux for over 10 years, a medication known to cause B12 deficiency. When I tested Marcus comprehensively, the picture was clear. His serum B12 was 290 picograms per milliliter, technically in the normal range but suboptimal. His MMA was 840 nanomoles per liter, severely elevated and confirming tissue-level deficiency. His homocysteine was 19 micromoles per liter, also elevated. He had macrocytic anemia with enlarged red blood cells. Every marker pointed to severe B12 deficiency causing his cognitive symptoms. I started him on intramuscular B12 injections 1,000 micrograms twice weekly, and recommended he stop the omeprazole and address his reflux through dietary changes. Within 1 month, his family noticed he was more alert and engaged. Within 3 months, his memory had improved dramatically. His depression lifted and he was back to his hobbies. Within 6 months, repeat cognitive testing showed normal function for his age. He did not have Alzheimer's disease. He had a completely treatable nutritional deficiency that was caused by a medication and missed by standard testing. If his daughter had not advocated for him, he would have been labeled with dementia and potentially placed in a care facility, all while suffering from something that could be fixed with simple B12 treatment. Remember at the very beginning I promised you something critical that could literally save your cognitive function and your life? Here it is. And this truth has the power to protect you from one of the most devastating but preventable causes of brain damage in older adults. The gift is this understanding. Vitamin B12 deficiency is not rare. It is not something that only happens to people with unusual medical conditions. It is extraordinarily common in people over 60, affecting anywhere from 10 to 40% depending on the population studied and the diagnostic criteria used. Most of these people do not know they are deficient. Most have never been properly tested. Most are experiencing symptoms they believe are normal aging, when those symptoms are actually signs of nervous system destruction that could be prevented or reversed with proper nutrition and supplementation. This changes everything because it means you have the power to protect yourself. You do not have to accept memory problems as inevitable. You do not have to watch your nervous system deteriorate. You do not have to become another statistic in the epidemic of preventable neurological decline. Armed with the right knowledge and taking the right action, you can maintain optimal B12 status throughout your life and preserve your cognitive function, your nerve health, your independence, and your quality of life for decades to come. Now let me give you the exact protocol to protect yourself from B12 deficiency starting immediately. First, if you are over 60, get comprehensive B12 testing right now. Not just serum B12, but the complete panel including serum B12, methylmalonic acid, homocysteine, and complete blood count. Insist on this testing even if your doctor thinks it is unnecessary. Advocate for yourself. Explain that you are at high risk due to age and that you want to prevent deficiency, not just diagnose it after damage has occurred. If your doctor refuses, find another doctor or order the tests yourself through direct-to-consumer laboratory services which are available in most states. Second, eat meat regularly, at minimum 4 to 5 times per week, with each serving being 4 to 6 ounces. Prioritize the meats highest in B12. Include beef liver once per week if possible, providing 70 micrograms in a single 3-ounce serving, enough to cover your needs for an entire week. If you cannot tolerate liver, choose other organ meats like kidney or heart. Include muscle meats like beef, lamb, bison, and pork, which provide 2 to 3 micrograms per serving. Include fish and seafood, especially clams, oysters, mussels, salmon, trout, and tuna. Vary your meat choices to get B12 from multiple sources and to obtain the full spectrum of other nutrients that support nervous system health. Third, if you take any medications that interfere with B12 absorption, work with your doctor to address this. Proton pump inhibitors should be used for the shortest duration possible, ideally no more than 8 weeks, not the years that many people take them. If you have chronic reflux, address root causes including food sensitivities, stress, eating patterns, and body weight, rather than relying on acid suppression indefinitely. If you take metformin for diabetes, ask your doctor about monitoring your B12 status every 6 to 12 months and supplementing preventively. If you have had gastric surgery or have conditions affecting your digestive tract, you will need higher intake from food and likely supplementation or injections. Fourth, supplement strategically if you are at high risk or have suboptimal levels. Choose methylcobalamin, not cyanocobalamin, in doses of at least 1,000 micrograms daily. Sublingual forms may be absorbed better than tablets that must pass through the digestive system. If you have confirmed deficiency or severe malabsorption, intramuscular injections are the gold standard treatment. These bypass the digestive system entirely and rapidly replenish your stores. Typical protocols are 1,000 micrograms intramuscularly once or twice weekly until levels normalize, then monthly for maintenance. Work with a knowledgeable healthcare provider to determine the best approach for your situation. Fifth, address other factors that support B12 metabolism. Ensure adequate intake of folate from leafy greens, liver, and other whole food sources, as folate works synergistically with B12. Maintain optimal levels of vitamin B6, which is required for proper use of B12. Avoid excessive alcohol, which damages the stomach lining and impairs absorption. Manage stress, which increases nutritional requirements. Prioritize sleep, which allows your body to perform repair and maintenance processes. Stay physically active, which improves circulation and nutrient delivery to tissues. Sixth, retest regularly to ensure your strategy is working. If you have been deficient, recheck your levels 3 to 6 months after starting treatment to confirm improvement. Once optimal levels are achieved, annual monitoring is appropriate for maintenance. If you are at high risk but currently optimal, testing every year or two provides reassurance and catches problems early before symptoms develop. Never assume your levels are fine without testing. B12 deficiency is silent until it causes significant damage, and by then treatment is less effective. Now I must provide critical medical guidance. If you have severe neurological symptoms including significant numbness, weakness, balance problems, or cognitive impairment, you need immediate medical evaluation and likely aggressive treatment with injections. Oral supplementation may not be sufficient to reverse severe deficiency quickly enough to prevent permanent damage. If you have pernicious anemia, an autoimmune condition where your body destroys the cells that produce intrinsic factor, you will require lifelong B12 injections as oral intake will not be absorbed. Work with a physician who understands B12 deficiency and is willing to treat aggressively rather than waiting for damage to worsen. The power to protect your nervous system, preserve your cognitive function, and maintain your independence and quality of life is in your hands right now. You do not need to accept memory loss as inevitable. You do not need to suffer neurological symptoms in silence. You do not need to become another person whose life is destroyed by a preventable nutritional deficiency. Eat meat regularly, especially organ meats and other B12-rich sources. Get tested comprehensively. Supplement appropriately if needed. Monitor your status over time. Give your nervous system the one vitamin it absolutely requires to function and survive. And watch as your brain remains sharp, as your nerves remain healthy, as your cognitive function is preserved far into old age. Your brain is counting on you to provide what it needs. Choose meat. Choose B12. Choose neurological health for life.